Be a concern every time a player puts that uniform on. When a star gets hurt, their stories often make headlines.
But sometimes an injury happens again and again, and it doesn't get talked about. In our medical moment, Fox 17's Tim Doty talks to Spectrum Health Medical Group about knee problems and female athletes.
He calls it the unspoken epidemic. While the latest injury often leads news programs and sports talk shows, Dr. James Lebolt of Spectrum Health Medical Group sees one over and over that really doesn't get publicized.
But in our face in the office daily is a 13 to 17-year-old female with an ACL tear.
Yeah, we've heard about it for years, but it still wouldn't hurt to get a refresher on what the ACL, anterior cruciate ligament, is and does.
So this is the tibial bone, this is the femoral side or the femur bone, this is the ACL ligament that bridges here. And without that, basically what you have is a shear force in the knee, which grinds away at the cartilage in the knee, which is the meniscus, which is the cushion cartilage, or the smooth shiny cartilage in the knee, which is the articular cartilage. And that also acts as a cheese grater effect and can cause some permanent damage.
More girls are playing sports these days, and that, coupled with some physiological differences in bone structure, particularly wider hip bones and what he calls knock knees, more girls are injuring the ACL.
Instead of just, hey, we have a female soccer league, come out and play, we have, hey, we got 4 female soccer leagues, and they all overlap at the same time. Can you come out and play? Absolutely. You know, these kids want to get out there and be active, just as active as their brother is. But what we're seeing is hormonally and bone structure-wise, we're seeing more exposures to ACL tears.
But is that a problem? The old story goes that unless you're an athlete, an ACL isn't really that important later in life. Dr. Lebolt shoots that down quickly.
My job is to paint the big picture. We want to look long term, so when you're your parents' age, are you going to be able to be out watching your kids participate? Are you going to be able to play out in the yard with your kids? And if you have some of these injuries, particularly injuries that you keep playing through or go untreated, there's a chance you may not be. Okay, there's a chance you won't be out there without a limp. Or there's a chance you're not going to be out there without pain because you're doing some long-term effects now.
The doctor says the only things shown to prevent ACL tears are a strong core and jump training. We'll look at those in next week's Medical Moment. Tim Doty, Fox 17 News.